Hello everyone, my name is Chow Kyn. You can call me Charles. I am a lecturer working in clinical pharmacy and pharmacy practice unit at University. I would like to thank Edu-Right for giving me this opportunity to share with you my life working as an academician in a private university in Malaysia. The content of my presentation today are self-introduction, skill set needed, job challenges and satisfaction, salary and progressions, am I happy or do I regret? This is a picture of M University. It is situated in Kedah and it was voted as one of the 10 most beautiful university campus in Malaysia. I graduated with Master of Pharmacy, specializing in clinical pharmacy from University of Science Malaysia. I also hold a Bachelor of Pharmacy degree from University of Malaya. As a pharmacist working with Ministry of Health for about 10 years, Malaysia Ministry of Health has extensively trained me. I also joined courses organized by other healthcare institutions, such as American Society of Health System Pharmacists, or courses organized by other universities, such as Manchester University, National University of Singapore, Monash University, etc. What I try to emphasize here is after you have obtained your professional degree, there are still vast opportunity for you to further your study or improve your knowledge in the field that you are interested in. I work as a pharmacist for about 10 years in government and private hospitals, 1 year in health district office, 1 year in community pharmacy, 3 months as graduate research assistant in University of Malaya, and now I'm a lecturer working in AIMS University. How do I decided to be a pharmacist? Since secondary school time, I have find out that I have compassion for people in suffering, either mentally or physically. And my favorite subjects are biology and chemistry. And I was afraid of blood and animal dissections. So I uh, thought that doing medicine is not a suitable choice for me. And becoming a pharmacist, I can have the ability to help people that are suffering physically and mentally. After talking to my parents, friends, and relatives, I discovered that there are huge market demands for pharmacists. The salary offer for pharmacists are quite good, and pharmacists are profession that is well respected by our society. What or who influences me? As a pharmacist, we do not work in silo. We work together with specialists, medical officers, other pharmacists, and other healthcare professionals such as nurses, medical assistants, dietitians, etc. All these healthcare professionals, they have their own expertise, and I have learned a lot from them in the way how I can manage the patients, how I can provide the best care for my patients so that they are able to optimize their health. What consultations I have received before pursuing pharmacist? I read a lot of books regarding different jobs, their prospects, what are their roles and responsibility. I also find out information from my parents, relatives, and friends. In the information's technology age, you can actually get a lot of this kind of information from the website. But one advice that I would like to give is you must make sure that the information that you have received are reliable, such as you can browse information from pharmacist associations, such as Malaysia Pharmaceutical Society, American Pharmacist Associations, etc. Or you can even speak to practicing pharmacists to find out more what their daily life is and what are their challenges, what is good about their current jobs, etc. I have been serving AMS universities for about 2 years, and what are the reasons that I joined academia is because I have great interest to train and shape future pharmacists. I also have interest to do research in order to gain more knowledge, to solve the current problems, and to improve patients' care. I would like to spend a bit more time talking about research that a pharmacist can do. I uh, categorize the research into different fields such as disease, medications, patient, pharmacy practice, and services. We can do research on how a disease is being transmitted. For example, we can study about nCoV, how this virus are transmitted, and the epidemiology of these diseases, such as which kind of people are easily exposed or easily infected with the disease, and if they are infected by this kind of disease, how how about the how about the recovery rate, and we can also do research on medications. We can discover new drugs that can be used to treat diseases. For instance, a lot of cancer are not well treated by the current medications. So we can do research to find out a more powerful medicines that can prolong the survival rate of our patients, and with a better safety profile that will not cause much serious adverse effect to the cancer patients. We can also apply our knowledge in drug formulation, such as we can increase the duration of actions for certain drugs. We can change the chemical structure of drugs so that their duration of actions can be prolonged. For example, uh, advising psychiatric patients to take their medications remain a great challenge. And if we are able to produce long-acting injections, the patients only need to receive the injections like maybe every 3 months or every 6 months, and the medications will stay in the patient's body for every 3 and 6 months. It will be very much easier for the healthcare professionals to monitor the efficacy of the medicine. We can also improve the formulations for, like example, skin preparations, so that they can produce better moisturizing effect to patients with dry skin problem. We can also design dosage form for animals, because animals have different anatomy and a bit different physiologies from human, and their dose their dosage form are also different from humans. As for the research done on patients, we can study on the knowledge, attitude, and perspective of patients on their medications, their illness, and also the healthcare service that they have received. We can also study what are the most effective drugs and what are the most safest drugs in treating selected disease in the selected populations. Through research, we can also find out what are the appropriate dose and also how we should adjust the dose of medications if a patient have problems such as renal impairment or liver impairment, where their dose of medication must be adjusted to prevent the toxicity effect due to the problem of their body to excrete and to metabolize drugs. We can also do research on pharmacy practice or pharmacy service field. We can find out what are the best practice standards or protocol to be carried out so that we can improve our patients' outcome or we can improve our patients' adherence. What are the case that we can give so that we can solve and prevent drug-related problem. Pharmacists also have role in health promotions, whereas we give advices and counseling to the patients so that they can improve their health and prevent them from getting disease. This is very important because after a patient getting a disease, you will need more treatment approach in order to treat the disease. I would like to share with you some of the pictures of student activities that is available in AIMS University. The Pharmaceutical Society of AIMS University have won the best and the most active pharmaceutical society for a few consecutive years. The students, they organize a lot of activities and events, such as a public health campaign, medication review in all sports home. They also attend competitions that are held in Malaysia or internationally. What are the attitudes required to become academicians? Academicians should genuinely care for their students. We should be able to always motivate our students so that they can become a better person or pharmacist. We want to bring out the best in our students, and we must also sincerely sensitive to different student needs and demand because everyone is different. And our responsibility is we want to give them the best available education so that they are competent and they are all able to compete when they are graduated from the university. A lot of services are actually started from the university. Okay, for example, is the total parenteral nutrition, cytotoxic drug reconstitutions, clinical pharmacy, ward pharmacies, and tech. They are actually started from the university, where the students were trained about these specialized pharmacy services. And after the students graduate from the university, they actually bring out this knowledge and the skill that they have learned to the university to serve our society. As for the behavior needed for my current jobs, we must have good time management. We must encourage high expectations. We have high expectations on our students because we want them to able to perform as their peak potential. And we also encourage leadership and teamwork among our students. As a lecturer, we must always give prompt feedback to our students. There is no point for us to give exam or lab work or assignment to our students without giving them feedbacks on how they can improve their knowledge or how they can improve their skill. In everything that we do, we hope and we want to involve our student so that our student can pick up a lot of knowledge and skill working together with us. About the challenges as an academician is the salary is mainly based on research your publications and postgraduate supervisions. And as an academician, we have very heavy workloads. We need to do teachings and learning activities. We need to do research. We need to do administrative works, marketing activities, community service, and etc. But it's very satisfying in becoming an academician because we have the vast opportunity to advance our knowledge in our areas of interest. And we have a lot of opportunity to contribute back to our society by training our future pharmacists and also by conducting courses to current practicing pharmacists so that the current knowledge can benefit their practice. And the research that we have done are also helping our patients to achieve better outcome and to help healthcare professionals for them to be able to function more effectively. As a conclusion, I enjoy my current jobs. This is a pictures showing our past graduating student batch. In AMS, we have about 100 students every year. Average monthly salary range different for different levels of academicians. For a lecturer, the monthly salary is from 6K to 10K. For lecturers that have a PhD degree, their salary is from 7K to 12K. And for associate professor and professor, their salary range is from 10K to 24K. There's always a potential progressions of academicians where they can achieve professorship. But the progression of career is mainly based on how many research that is published and also how many postgraduate students that academicians can produce. Besides that, academicians can also specialize in certain area of their interests. And I'm happy with my current job, yes, because this is what I really want to do in this phase of my life. And would it make a big difference if I know what pharmacy really does before I embark into any pharmacy course? The answer is yes, because if you know about one profession well, you can actually prepare yourself. For example, you can gain more information either to more reading or talking to the expert in the field, and then you can prepare yourself well and to make sure that when you are embark into the pharmacy course, you can make sure that this is the course that you really want to do. Okay, and pharmacist is the profession that you really want to work after you graduate from the universities. What advices for potential pharmacist graduate? First is you need to know who you are because everyone is different. And then who you want to become. Okay, I have shown you some of the very successful persons. They are very successful in respect of their professions in different field. Okay, do you know any one of them? Okay, the first picture is a foreign nightingale. She is the mother of modern nursing, and she started uh, formal nursing training, and she has saved a lot of life during the war because she have started a lot of services such as improve the nutrition for the soldier, infections control, hand sanitizing, etc. The second person in the middle is actually Alexander Fleming, sorry. He is a scientist and he is also a doctor and he is also a microbiologist. He has discovered the first antibiotic, which is we call as a penicillin accidentally. Before antibiotic were discovered, a lot of people were killed by bacterial infections because they have to depend on their immune system alone. After antibiotic is discovered, it saved millions of lives because we have a powerful uh, weapons to help our body to kill all these harmful bacteria that can causes organ damage and also even death. And the third person is actually uh, Maria Curie, and she is a medical physicist, and she discovered X-ray that is widely used in the medical field today for us to see what are the anatomy, what are the dysfunctions that is happening inside the human body. There are some self-reflection questions that you can try to reflect on. Who are you and what do you value? What do you love to do and what are you good at? How do you want to live your life and who do you hope or want to be? Living your dream jobs is you need to find a job that you are passionate with, you love to do, you are good at, and there is a high market demand, and you will receive a good pay. This is called as a ikigai in Japanese, which means that this is the reason of being, or this is the reason for living. I would like to read to you a poem written by a father named Soza. Happiness is not a destination, it is a way of life. Dance as though no one is watching you. Love as though you have never been hurt before. Sing as though no one can help you. And live as though heaven is on earth. Knowing who you are and who you want to believe is very important for you to decide on what are the jobs that you want to do after you graduate from the university. And don't let other voices to stop you from how you want to live a meaningful life. If you have any questions, you can post it in uh, in post, and I will answer you when I review these questions. And once again, I would like to thank you for your time, for listening to my sharing.